The COVID-19 pandemic has forced nonprofit organizations to change the way they do business and make quicker decisions to support growing community needs. How can service organizations pivot their messaging during a crisis and safely administer critical services to those most in need? Welcome to the Ad-Libber podcast, featuring conversations of influence, some of it planned, much of it ad-libbed.
Well, welcome to the first remote episode of the Ad-Libber. Co-hosting with Michaela and I this morning is Jess Staub, Senior Marketing and PR Manager at Gavin. And our special guest is Patricia Fonzi, President and CEO of Family Health Council of Central Pennsylvania. Welcome to the Ad-Libber.
Good morning.
Thanks, Jay. I'm definitely excited to be joining the podcast. As Jay mentioned, I'm Jess Staub, Senior PR and Marketing Manager. I've had the joy to work with Patricia Fonzi and her fabulous team at FHCCP for almost as long, for 5 years that I've been at Gavin. I think we started, Tricia, working on a Tapestry of Health WIC project, and we kind of went from there. We've done a few campaigns recently, and what I've noted throughout all the time of working with you is just how tremendous you and your team truly are. You're so dedicated to the work that you do, both inside the office and outside the office, just every day in the lives that you're living and the work that you're doing. And why don't we start by hearing a little bit more about you, what led you to FHCCP, and a little bit more about what FHCCP does.
Well, thank you, Jess, for saying all those nice things. I can say equally, I feel the same way about Gavin and the staff there and just how much value that partnership has brought to us. I was delighted to come on and talk about it. You know, we were hoping to get to see each other in person and do this, but as you know, I was game to be the first one to do this remotely, or at least give it our best shot, right? So a little bit about me and kind of my background. And, in starting for this, I really did try to think about what are things that are podcast worthy, because as a podcast fan, you want to kind of live up to the expectation of a podcast that people want to listen to. And so weirdly, probably my most podcast worthy story, and I think there are podcasts about it, is actually how I came to FHCCP. And it starts when I was in graduate school. I had a bunch of different jobs, including doing community education and outreach at the family planning clinic there. And as a student, it was great because I got to do a lot of work on campus. I did lots of HIV counseling and testing education, and actually HIV counseling and testing. And again, this was in the early 90s, right? So it was a very different time. That work was considered like the most innovative thing you could be doing in a family planning clinic at the time. And I loved it, and I kept going to graduate school, and I never really thought of that as a career. I really had a different path planned for myself. And then, from there, a series of jobs that I didn't like very much, and landed in Carlisle at one of the jobs that I didn't like very much. And my husband was at Gettysburg College. He wasn't my husband at the time. We had actually been married less than a year when this happened. And he was on call one night. He was a residence hall director. And I had already thought about pretty much quitting the job that I didn't love for other things. And, even I thought maybe, I would work like at some department store selling things and just have like a really low stress, whatever. We were very lucky because we lived on campus. So again, when you don't have to worry about rent, you have this opportunity to just kind of be like, what are you going to do? And I was almost asking for a sign of what to do. And my husband was on call this night, and I remember when he left, what he said to me was, I have no idea what this call is about, but I think it's going to be a long night. And about 5 hours later, he came home, and this is what he told me, that a student of his had driven to Delaware and helped his girlfriend deliver their baby in a hotel room. She became very ill and ended up at the emergency room, and he had traveled back to Gettysburg, and they needed to know where the baby was. And through the course of the things that the student told him were the following. They had tried on more than one occasion to seek an abortion, but they were concerned about protesters and a 24-hour waiting period and all the rules that are up around that. They weren't using birth control because she thought that her parents would know. So the system failed these two people in so many ways that led them to this, whatever decisions they made in the hotel room that night, that led to the death of this baby and both of their subsequent incarceration as a result of it. And I was so overcome by that, of how, to me, how easy that was an upstream problem to solve. If there was better access to contraceptives, and I had done the work, like the solution was right in front of me. So I literally opened the phone book, because that's what we did in 1996 in November, and looked up Family Health Council, because I had worked for an organization of a similar name that's now subsequently changed their name. And I made a cold call, and our receptionist, Judy Owen, who still works for us, I basically told her that I wanted to come and work there, even if it was as a volunteer. And little did I know there was a position open. And I started January 2nd, 1997, and my first title was Assistant Director of Program and Development. So I really did feel like that was the sign that I kind of wanted to know what to do and how to take my career. And I was so just humbled by the chance to get to do it from the moment that I walked in the door, because it's always been great people, and the work is, and I've gotten to do a lot of things other than family planning, and that has, right now in this day and age, the work I ended up, one of the things I did was a lot of HIV work, and those skills have come in so handy lately. The fact that I know what an antibody test was, I never thought I'd need that skill again, and now suddenly I do. So I have just been lucky to have lots of different bosses and lots of different job titles, but just the complete commitment to the mission. So that's how I landed there.
It's interesting that you brought up HIV, because one of the things that we've talked about before is how HIV has changed from the 90s to today. And you've really been on the front lines to see some of that. And I'm sure that's really interesting to you to see how something like HIV evolves over time.
Oh, absolutely. And it's one of the things that gives me hope.
That's awesome. That's awesome. So beyond HIV, can you talk a little bit more about the services that FHCCP provides?
So our mission is to build and support community-based health networks through partnership, advocacy, education, and effective resource allocation, which is this great mission because it really is about identifying what communities need, putting partnerships together with the resources that are out there, and that can be grant funding, it can be other funding, and building a system of care. I mean, that really is how we approach whatever we do. We look at building it like a network, because the one universal truth about all of the programs that we see is no one type of provider has all the solutions, no one health system has all the solutions, and that the solutions need to be driven by that community, right? That they need to be part of how communities solve whatever issues they're facing, health or otherwise. And so we kind of bring that to the forefront. And I think if you look at our programs, that really is the common theme, and that we target those in most need of service. So it's not, I hate the term underserved, because that implies this like status, because it's about need. It's not about that. So it's those that are most in need of services, whether it be from their low income status or a health disparity that they face, or transportation, something that simple as that. That really is the problem that we try to solve.
One of the things I love about working with you all is that you don't just reach one type of population. You're looking at, especially across geographic regions, you're looking at rural, urban, suburban, truly a mix of every type of living environment. So can you talk a little bit more about how widespread FHCCP services are throughout Pennsylvania?
So we go as far west as Somerset and Cambria County, And that part of the state is sometimes often aligned more with like a service delivery system out of Pittsburgh, right? So you could be working with a whole different network of providers. The same with like Bedford and Blair County out that way, Franklin and Fulton. And then we go all the way down to the Maryland border, across over to Lancaster and Lebanon County. And again, COVID-19 has taught us the connections between those counties and Philadelphia, right? Like those, we think now that the outbreaks in those, what I call the Amtrak counties, will be forever linked to the outbreak in Philadelphia. So we interface a lot with those areas, but then we also go north to Center County, like Homing County, which is the much more rural kind of, I think, when people think of central Pennsylvania. So it's everywhere in between. So, the region itself is so diverse that I think is one of the reasons it's kept me there, because you can tailor a project to what WIC moms need in Cumberland County, and it'd be totally different to what you're doing in Bedford County for all the right reasons.
Yeah, so you mentioned COVID-19 throughout this a couple of times, and it's hard to not bring that up right now.
I can't
And what
not,
we're
right?
seeing. I do want to talk with you a little bit about some of those things that have come up. One of the things that we've been fortunate to work on with you was some messaging geared toward SNAP in particular, the Nutrition Assistance Program, just making sure that we're getting the message out there that you shouldn't have to make a decision between paying rent or buying groceries, putting food on your table.
You can't not mention COVID-19, and it is one of those, we're getting to watch how it's changing, how we're doing business in real time. And you can't not reflect on other things that we've done, right down to the changing the messaging on the Keep Relationships Real campaign, with a social isolation theme, shall we say.
Yeah, and I'm so glad you brought up Keep Relationships Real as part of that conversation too. Keep Relationships Real is one of the more recent campaigns that we've worked on, dedicated to family planning, sex education, and it really did evolve. Initially, when we put that plan together, we were planning on prom advertising, and look at how that changed. We had to pull that back, and that's just what happens. And the benefit is that your team and the Gavin team is working in real time to address those hardships and determine where we need to pivot and when. And one of the other things that we've pivoted to that is interesting is I think it started as a call or a text, Tricia, that you mentioned us. What about porn app advertising for
Right.
Keep Relationships Real?
Yeah, that was, well, we had realized, and I don't know anything about this, I feel like I'm repeating you back to you, but that we had these great response rates when we had used Grindr for an HIV campaign. And honestly, Grindr was very receptive to working with us. I think the question that we asked the staff was, where are adolescents and young adults really learning about sex? And the answer was porn. And it was like, well, if that's where we could argue with that and say, well, that's unhealthy or that shouldn't happen, and that gets us nowhere. Or we could say, well, what if we put some alternatives out there? So at least if they're watching porn, they might see one of our ads. And we had come up with that tagline that Keep Relationships Real way before this idea, but we also loved that idea of the messaging of using apps that were kind of, and again, we're saying porn, we don't know for sure where we're going to go with that, where that's going to lead us into the more specialty apps. But this idea of keeping relationships real at a time now when many of your relationships may be virtual, right? So we have this other opportunity to do this great message about how to support your relationship during social distancing, and how to stay sexually healthy during social distancing. So again, it was just one of those, how do you not kind of seize that opportunity as it moves through? And again, we had decided to advertise on Pornhub before we realized that everybody was going to be stuck at home, and that much like HBO, all they're watching is probably skyrocketing. So it was probably a really cost-effective time for those ads.
Right, right. And right after we launched and got into it, they actually took down the paywall on the porn advertising app. So, I mean, it couldn't have been better timing, and we've seen engagement skyrocket. So some ideas that we talk through, they start as a simple text message, a simple call. Some ideas, though, really stem from surveys that we've done with you all. And that's been so interesting to see the results of some of those surveys with both the Keep Relationships Real campaign, and we've done an HIV campaign with you, Take Control of Your HIV. And in both instances, you know, we've surveyed community leaders, we've surveyed your partner providers, and also patients and the general public, and, you know, gotten tremendous feedback that way, that we're able to take that feedback, we're able to process it, analyze it, and determine messaging that's specific to certain populations, and also determine what the ads themselves should look like, because we want them to look like the people who are seeing them, right? Like, I want to see myself on the ad that I see on Instagram, which is the platform that I choose to be on. And that's really where people are right now in this day and age. And we've been able to do that with a lot of the campaigns that we work with you on. And that's been a really cool experience, because the awesome part about FHCCP, you all are willing to break the mold, if you will, kind of do the unexpected. Another example of that was we had a cervical cancer screening and breast cancer screening campaign. And instead of doing traditional pink, you encouraged us to go with yellow. You said, you know, do something different. And we had so much positive feedback from that, from choosing the color yellow. And that was mostly because you all were willing to explore that.
No, that was a great example. And, you know, we were trying, and I can tell you a little bit about how that came about. We were working as an organization at really trying to expand our capacity at looking at everything through an LGBTQ lens. And one of those things was our STD forms that we used to have to fill out, that were literally pink for girls and blue for boys. And the staff person would have to basically assign the person a gender and hand that person the form. Well, you can see why that wouldn't work with all clients. And so we were very lucky. We were glad that was one of the things that we were able to change. And then electronic health records happened, and you didn't have to worry about forms anymore. But that was one of the, we just knew that our clients that could seek services that didn't identify with the color pink, for whatever reason that was, that we wanted to make sure they were included in that advertising and that they saw themselves in it, like you said. And that went down to the color yellow. And, you know, it's like what color you paint your nursery before you know what the baby's going to be, right? Like, it was one of those, and yeah, something that simple. And then through that, you know, that program evolved, and we were able to see people that identified as men, that identified as different genders. And what we classified it was healthy parts, was kind of what we ended up calling it. And it was more about if you were on hormones, if you had a cervix, if you had breasts, and much less about your gender. And so we were able to use the yellow all the way through, where I watched my other partners that had pink affiliated things, you know, suddenly starting going to grayscale more. So anyway, that's a great one. I mean, yeah, the other one though I thought of, Jess, is HIV was one. When you mentioned the surveys and talking to clients, that, you know, that's a program that from my whole history has really touched on consumer empowerment, because clients, you have to listen to them to get an understanding of how best to serve them, because the needs can be so disparate, right? Even amongst people living with HIV. And so we learned that's, you just have to tune in.
Yeah.
And that was so clear that for consumers of HIV services, and that's so important to us too, that's the other piece, we needed to represent them as empowered in the advertising. We didn't want to use a scare tactic and scare anybody about having HIV, because what does that say about the people that are living with it, that are our friends and colleagues and sitting in that room with you? You don't want to instill stigma through your advertising. And so I think that was and again, it wasn't so much about staying away from red as more we wanted this to invoke this feeling of, if you have HIV, you can still be successful, you can still be empowered, you can take control of your health. Like, it really became much more about helping people know that we should be reducing the stigma. And I don't think that when we went into that campaign, like if you looked at the notes, I don't think we would have thought that coming out of it, but it just was something we were really proud of. And that's why I think that's, the staff want to keep that campaign going. Like, it was so successful that we are now in, like, I don't know what phase we're in now of it, probably 4, of taking it through all those different iterations as a way to kind of keep it going. So anyway, it was just I agree with you. And I don't take credit for that, turning things into the unexpected, though. I'll tell you that it comes from just asking my staff good questions, honestly. It's the same strategy that you use with your audience to, like, get them thinking. You just have to know the right questions to say, well, how could we do that a little differently? Or what do you know about what your client wants about this? Or, what have you heard lately? Or, what has been your shower thought, Dave? Those kind of things. And then they just kind of can go a little bit, and it ends up with really great products. I trust the process with you guys.
Yeah, what you mentioned with the HIV campaign, it brings to mind one of the survey results that came back early on when we said the phrase, I'm living with HIV and I can live my ordinary life. Is that a good message for anyone who has this? And right away, one of the partner providers wrote back and said, I'm living with HIV and I can live an extraordinary life. You need to change that. It's not just that you can live a typical everyday life. You can accomplish your dreams. You can do more than you ever imagined because you're just like anybody else. And that really stuck with me. I'll never forget that. And that's one of the benefits, again, of doing that research, is getting that feedback and understanding.
Mm-hmm. Yeah. No, and that's, when you talk about, like, moving moments you've had over the course of your career, again, that's one of those where you just know, like, wow, I've learned so much from this, and it's going to change how I do business, right? Like, that's the COVID-19 example, right? Like, I'm learning so much that I'm going to change how I do business because of it.
Things have changed a lot because of COVID-19, and it's not just impacting the healthcare industry, it's certainly impacting, all walks of life. And I was hoping you could talk a little bit about, how it's changed the way your organization, communicates with partner providers, and also, like, how do you see, services maybe shifting as we get, into later in the spring and summer?
Yeah, well, I wish I had my magic 8-ball that I have in my office, because I sometimes get my magic 8-ball out and use that to generate questions. So I think, that's the first thing. It's really hard to tell how long any of this is going to go on. Like, that's the question nobody, we're talking about it like in circles, right? And so, I will tell you guys, though, we were early adapters. I set my staff, we started going home the first week in March because we had been, luckily, as a public health organization, we had already been in touch a little bit with what was happening. Things are happening so fast, the data takes so long to catch up, you can't make decisions based on it. So that, I think, is a huge challenge. So we started sending all of our admin staff home. We started deploying teams out. Like, we kind of figured out who would be able to kind of be done first so we could start practicing some social distancing in the workplace. And that was on the administrative side. And the reason for that is because we knew that we were going to need to keep WIC and SNAP and other operations, the client-facing side of the things, running. So we wanted to get our staff kind of tucked away at home as soon as possible. So I think the last day anybody was in our office was March 9th. And then we were really able to just give staff assignments to kind of keep things churning while we turned our attention to the client facing side of the business that we do, the direct service side, because again, that's where the need was, right? Like that was certainly probably where we had to gear up the quickest to serve more people, right? Like we weren't just trying to figure out how to stay open during a pandemic, but we were also trying to figure out how great the need was going to be and what that was going to do to impact it. So it was kind of one of those things very magnified. So usually when this happens, it's like when a plant closes in a community, right? Manufacturing shuts down. We can see an impact on one or two sites, right? This is, just so beyond that for how we're seeing the impact of the people that are going to need it. So yeah, we've had to really change physically how we do business, everything from, gloves and masks and all of that. But WIC, we've moved to telehealth now, but it took a little while. We had to have some of the technology and things had to catch up. But we're going to still have to do some visits, but we need to be prepared. This is going to be a long haul. We know we're going to be going back in the office at some point where we're still going to be seeing hotspots and things. So our prediction is we're going to be doing some version of this on and off until one of a couple of things happens. There's a vaccine. There's more access to testing. There's more access to antibody testing, and probably significantly improved social isolation in some communities where hotspots are coming up. So we just have to be kind of in it and prepared for all the changes. And I would be remiss. I mean, I feel like every opportunity I have, I need to talk about the leadership of our Secretary of Health and our governor through this. And I have friends, public health is a national and international community who say things like, your predictions online, because everybody's going online and seeing all the predictions. Why does Pennsylvania's look better than others? And I'm like, well, it's because of their leadership. I mean, without a doubt, it will have saved lives when all this is over. And, I know some people don't think they're doing enough, and there's lots of reasons for decisions that are being made. But I think, honestly, they have been amazing leaders for anyone that's working as their partners in this. And they really view us as partners. So we are, acting on their behalf and delivering these essential services.
I guess the other part of that is thinking, when we do come out of it, everybody's probably looking for ways to, be more efficient, maybe use some of the things that they learned throughout this process and try to carry them forward. What do you think will kind of, maybe remain, that comes from this whole pandemic period that we're in right now?
Well, we're certainly all going to get better at Zoom and Microsoft Teams, that's for sure. I think if any employer thought that staff would be less productive at home, they were wrong. Because not only are I finding my staff to be amazingly productive, I think they're more efficient in their communication. They can get things done. What they would have spent an hour meeting about, they really are accomplishing in an email. So I think that is I think it's a workforce proving to us how good they've gotten at working together in teams, that they're able to do it virtually. Like, I have been nothing but impressed by my staff's ability. And I was a little bit of a skeptic about teamwork, and I still am a little bit. I think there are going to be still some things that we're going to have to do virtually. It was hard having an all-staff meeting and hearing all of my staff's voices out there. It feels like the world feels like a very big place, right? When that's your only way of interacting with the team. But I think that we just are learning what our capacity is. And I also think the other thing we're learning is the work-life balance and how fragile that is. And as we're working at home, how we have to be so careful to protect that because of the impact that it has on our mental health. And that's whether you're going to the office and checking your email at home, or you're like me and you're coming upstairs, right? It doesn't matter. You have to still block yourself out and take vacation days and do all of those things, even if you're working at home. So I think it's kind of ever changing. And I think from the what this is going to be is it's probably going to be versions of this, right? Like if there's another outbreak in central Pennsylvania or in Pennsylvania in the fall, we may go back and feel like we're functioning pretty normally, and then something happens that necessitates another round of behavior change. And I think we're going to just be seeing that until we get, like I said, the testing for lots of reasons. And again, that's an offline conversation about how much better we have to get at that, or some type of a vaccine.
Mm-hmm. Outside of the COVID-19 situation, I know we talked a lot at the beginning about what led you to FHCCP and obviously the role that you're in today. Looking forward, what inspires you to kind of continue in this field, or what will you take from this moment, and how will it help you further advance in your career?
Well, and again, there's so many, but I will tell you that as a field, the collaboration and online learning, we have to figure out the way we leverage this going forward, because it would be a shame if, I can take a class on COVID-19 for free through the London School of Health and Hygiene, and then Johns Hopkins doing an epidemiology class online. There's everyone from the attorneys that represent us to you guys are helping us kind of develop these strategies. But I think what we're going to learn is they could improve what we do anyway. And what I hope my lesson is, why didn't we do this sooner, right? Like why did it take a pandemic to force this level of teamwork and collaboration that the power, if we can harness this to do the things that we want to do. So I'll tell you, my team has already thought about the failure that was the HPV vaccine implementation. And, Jess, you talked about Healthy Woman. We've already talked about how whatever this vaccine looks like, we're not going to repeat that. We need to make sure it's accessible to as many people as possible right out the gate, right? Be as effective as possible, drive through whatever. Like whatever we do, we don't want to put up barriers, and that we need to get a hold of the messaging, right? We let the messaging for HPV be controlled by the people that were against vaccines for a lot of reasons, and we can't let that happen again, right? Like right now, we already know, in my head, I'm writing the pro-COVID vaccine campaign that we could be working with Gavin on. Like that really is, we just need to be thinking about all of these things that we're learning and how we keep applying all of that. Like how does that work in China? They have a bigger population. Let's figure that out, and how do we apply it here as quickly as possible? The opportunity part of that is limitless. We could do another whole podcast about that. It's just we're limited right now by the fact that, I would be remiss if I didn't talk about, the partners that we have that are on these front lines, and that including our own staff that are doing WIC services right now, and figuring out how we can best support them through this is, because sometimes it really is just being there for the phone call when they get off duty, or being able to make that report just a little bit easier so the money comes a little bit faster, or whatever we can do to help these agencies that are on the front lines of this in so many ways. Seeing patients out of their strike zone, like so many of our nurse practitioner partners are, or they're the staff that have just been assigned to answer phones right now and field the people that are calling 5 times a day for their test results. I mean, I can't tell you the stories that we have of this network of providers that are, while protecting their clients at the same time, are they're heroes. They really are absolutely heroes in all of this. So.
Well, Tricia, I just want to say, from the way you're looking ahead to the future, the way you're managing the FHCCP staff, and the way you are fighting for, advocating, serving populations who need it throughout Pennsylvania, you are a leader who I personally admire outside of the office. I really appreciate all that you do every day. thank you again for joining us, for being on the Ad-Libber. I really, really appreciate it. I know Jay and the entire Gavin team appreciates it too.
Well, thank you guys so much. We love working with you, and I can't wait to see what's next.
Thank you.
Thanks, Trisha.
Thank you for listening to the Ad-Libber podcast. To find new episodes and get more content from our team here at Gavin, make sure to visit our website at adlibberpodcast.com. The Ad-Libber is also available on Spotify and Apple Podcasts.